Thank you very much, Goldie Gopher, my favorite mascot. Good morning, everyone. I am John Finnegan, Dean of the School of Public Health, and I'm delighted to welcome you today. I have had the privilege of serving as Dean of the School of Public Health now for almost 17 years. And this past year, for obvious reasons, has been one of historic importance both for the university as well as for the School of Public Health. But one benefit of serving as dean is that you get to support and shout out the success of your amazing faculty. We are so grateful and excited to be gathered virtually with you all today. This is an incredible moment for Blue Cross Blue Shield of Minnesota, for the University of Minnesota, the School of Public Health, and it is all due so much to the vision and reputation of Dr. Rachel Hardiman and all of her colleagues who work in the domain of health, equity, and racism. So today we celebrate the founding of the Center for Anti-Racism Research for Health Equity. Now, before we get into the center of today's program, I do want to acknowledge with you that the University of Minnesota Twin Cities campus is situated on the ancestral land of the Dakota people. And we acknowledge the ongoing debt that is owed to the Dakota people. And we strive as a university to create healthy dialogue, relationships, and practices that address this injustice as well as others related to the indigenous people of Minnesota. I'd like to recognize the groups and the individuals that are joining us today, but who are not shown on our screens. And these include members of the Blue Cross and Blue Shield Board of Trustees, the Foundation Board of Directors, and members of the executive team. The Board of Regents of the University of Minnesota, the Foundation Board of Trustees, the School of Public Health Campaign Cabinet, and members of our leadership team. I also want to recognize two people whom you will not hear from during our program, but I want to acknowledge them for their tremendous efforts in making this center a reality. One is Dr. Mark Steffen. He's chair of the Blue Cross Blue Shield of Minnesota Foundation and vice president and chief medical officer of Blue Cross Blue Shield of Minnesota. And second, Dr. Tim Beebe, Mayo professor and head of the Division of Health Policy and Management in the School of Public Health. Tim played a major role in this initiative. He connected Dr. Hardiman with Blue Cross Blue Shield, and he has advocated with her for this important vision that they were able to share with them. So thank you all for your contributions and for being here today. The Center for Anti-Racism Research and Health Equity is why we're here celebrating, and it is founded through a generous $5 million gift of Blue Cross and Blue Shield of Minnesota. Now, Dr. Rachel Hardiman created the vision for the center, and she will serve as its founding director. All of us at SPH are inspired by the trust and the confidence that Blue Cross has in this university and in our school, and the bold vision that was put forth by Dr. Hardiman. And we are equally inspired by our aligned commitment to giving the people of Minnesota this opportunity for building equity and health and well-being in our underserved communities. Let me tell you a little bit about the School of Public Health. We believe as a basic value that health is a human right, and we're committed to living this value by becoming a powerful advocate for health equity and for racial justice. This new center is going to advance that sweeping vision, and it will support the steps that we are taking as a school to become an anti-racist community. And this helps us to create a platform to further Dr. Hardiman's pioneering work and that of so many of her colleagues. The Blue Cross gift is the largest that has ever been made to a center at our school, and we are all deeply grateful to Blue Cross for its willingness to step forward and to join us as we seek to identify, to understand, and to dismantle structural racism in the pursuit of health equity. And at this time, I want to invite you all to watch a brief video that will give you a sense of the center's commitment to anti-racist health research and to creating long-term change. After the video, President Joan Gable, our 17th president of the University of Minnesota, will share her remarks. And President Gable has been a great champion of efforts across the university that have spurred meaningful action toward a more equitable and just future for all of us. But for now, please enjoy this video.
So I think a lot of things need to happen to change how racism impacts health and to dismantle really the impact of racism on health so that all communities are able to achieve health equity. So I would say racism impacts people throughout the life course. We know that Black and Indigenous infants in particular are twice as likely as their white counterparts to not make it to their first birthday. And that's true here in Minnesota as well as nationally. The impact of racism on health is starting before a baby is born, but once they're born, if they survive that first year of life, there's going to be an onslaught of disadvantage that comes their way across the life course. So we know that 1 in 1,000 Black men and boys have a chance of being killed by a police officer in their lifetime. Here in Minnesota, we are seeing that Black people are more likely to die from COVID-19, and they're also dying at younger ages. So I think COVID-19 is actually the perfect example of how we can ask different and more sort of nuanced questions to get at the heart of what's really going on and therefore figure out how to change it. So early on, the question was, why are Black people so sick and why are Black people so, disproportionately impacted? But we didn't stop to ask the question, what are the potential systems or policies that are rendering Black and brown communities more susceptible to this disease? And I think by shifting the question, we understand then that when we look at the data, Black, Indigenous, and Latino communities are more likely to hold jobs where they are, exposed daily to COVID-19 because they aren't able to work at home. When we talk about an anti-racist approach to research, we're talking about an approach that understands history. An anti-racist research approach also requires that we center at the margins, meaning that the people that are closest to the pain, the people that are grappling most with these issues and are impacted most deeply by these issues are able to lead the work. We have 4 goals that we will focus on in this research center, and those are research, education, authentic community engagement, and also narrative change. And they can't sort of exist disconnected from one another. They are all very much intertwined and sort of support each other, because without authentic community engagement, we can't have real evidence-based research to inform policy and to inform and create change. Again, I think that the education piece is incredibly important as we think about our future in public health and our future workforce and those who are really truly committed to anti-racism and ensuring that it shows up in the ways that they practice public health and are working towards health equity. So the generous gift from Blue Cross and Blue Shield of Minnesota, I think, speaks to the power of collaboration and their bold vision, along with my bold vision of a healthier Minnesota. For me, success, in the biggest sense of the word, would mean that everyone has the same opportunity to be healthy. And success looks like every life being valued in the same way. I fully acknowledge we are a very long ways from that, and that our center will be one part of a larger effort and push that we're seeing, and movement, frankly, that we're seeing across the country to dismantle racism in all of its forms and to achieve equity.
Good morning, everyone. I hope that you are all healthy, safe, and well. I want to thank everybody for joining us today to celebrate this transformational gift from the Blue Cross Blue Shield of Minnesota Foundation. The video does a wonderful job of highlighting Rachel's work and illustrating the importance and impact of the Center for Anti-Racism Research and health equity. But we'll get the chance to hear more from Rachel soon. And I know you will join me in just being so grateful that she's channeling her passion and intellectual curiosity in such a beneficial way for our entire community. Friends, the University of Minnesota is really committed, as Rachel describes in the video, through our new system-wide strategic plan, Impact 2025, to foster a welcoming community that values belonging, equity, diversity, dignity in people and ideas, and is a contributor to the dismantlement of systemic racism. We have prioritized increasing diversity, representation, improving campus climate, and building, supporting, and aligning partnerships and community engagement through this plan. We will hold ourselves accountable, and we fully recognize that we have a lot of work still to do as an institution. But amongst our faculty, we have tremendous good work already underway, and we're extremely proud to recognize the center's and Dr. Hardiman's important work and advances in these shared efforts in meaningful ways that we know will elevate and accomplish the goals that she articulated so clearly. So on behalf of the University of Minnesota, I want to offer my sincere appreciation to Blue Cross Blue Shield of Minnesota for this important investment in the University of Minnesota and our communities. So at this time, with appreciation, I'll turn it back over to Dean Finnegan.
Thank you very much, President Gable. And I now have the pleasure of introducing Dr. Craig E. Sammet. In his role as President and Chief Executive Officer of Blue Cross and Blue Shield in Minnesota and its parent company, Stella, Dr. Sammet is responsible for overseeing the strategy and operations of the state's first and largest healthcare plan. Dr. Sammet, I do want to take a minute to thank you personally for all that you've done to make this center possible. And I refer to the Blue Cross gift as destiny changing. And I believe that it's going to do that for the communities in Minnesota and across the country who've suffered ill health as an effect of racism for centuries. So thank you very much. Dr. Sammet also came to Blue Cross in 2018, July, from Anthem, and there he served as Executive Vice President and President of their diversified business group. He also built partnerships, and he deepened Anthem's relationships and impact across the healthcare ecosystem. And at the same time, he was leading their nationwide clinical vision and strategy as Anthem's Chief Clinical Officer. He is an internal medicine physician by training, and he's worked across multiple sectors with the healthcare industry. He is a nationally recognized expert and thought leader on healthcare delivery and policy, and his record of collaborating across the healthcare system to deliver higher quality care at lower cost has led him to being named one of the 50 most influential physician executives and leaders. And that was by Modern Healthcare in 2018. And also he was recently named one of the 100 most influential healthcare leaders by Minnesota Physician just this past year. Dr. Sammet also received the Alumni Achievement Award from the Wharton Healthcare Management Alumni Association in 2020, and that was for his contributions to healthcare management. And he also serves on the editorial advisory council at Fierce Healthcare. As you could imagine, he also serves on multiple boards that include the National Committee for Quality Assurance, Blue Cross Blue Shield Association, the National Institute for Healthcare Management Foundation, Prime Therapeutics, Minnesota Business Partnership, the Minnesota Council of Health Plans, and the Twin Cities Habitat for Humanity. And if that weren't enough, he is also a former commissioner of the Medicare Payment Advisory Commission, an independent agency that advises Congress on Medicare payment policy. Finally, he holds an undergrad degree from Tufts University, a medical degree from Columbia, and an MBA from the Wharton School of Business. He completed his medical residency in internal medicine at Brigham and Women's Hospital in Boston, and he is a fellow of the American College of Physicians. Please welcome Dr. Sammet.
Thank you very much, Dean Finnegan, and good morning, everyone. I very much appreciate the humbling introduction. It's certainly not deserved, and I only regret that I went to lesser schools than University of Minnesota. But you should know that I'm proudly geared up for our event today. Well, it's good to be with all of you, and on behalf of the whole Blue Cross leadership team, our board, our foundation board, and our team more broadly, many of whom are here, as the Dean described. I'm honored and humbled to be with you today for this very important, groundbreaking event. Our mission at Blue Cross is to transform care, inspire change, and improve health for the people we serve. And as part of that mission, I wanted to share with you a few of our own beliefs. And I know the Dean had mentioned a belief of his own, but I'd like to share several of ours because I think it serves as a foundation for why this center is so important for us. We believe at Blue Cross that health is a human right and that every Minnesotan, and frankly, everyone beyond Minnesota, should have an equal chance to live a long, healthy life and have access to accessible, affordable, high quality, and equitable care. And as Dr. Hardiman mentioned in the video, and as the university believes, we are on a quest for a healthier Minnesota. We believe that an ounce of prevention is worth a pound of cure, and that transforming care will require us to study, to invest in, and to deliver on what is in the ounce. We believe that systemic racism is in that ounce, and that to improve health, we must become an anti-racist organization ourselves, and that we must join forces with others to help our community become anti-racist. We believe in the science of evidence, and that research shows us the way to make improvements in our community and in our health. And we believe we can't get there from here without partnerships just as we're forging here and that we're forging with many other provider organizations and businesses and social service organizations throughout the state of Minnesota. And lastly, we believe we have a role to play outside of the traditional expectations of a health plan to address systemic racism and its destructive impact on health. We can't just be a health insurance company. We have to be a social services company, a well-being company, and an anti-racist company. So for all these reasons, we're proud and we're honored and we're humbled to support the establishment of this important center at the U under Dr. Hardiman's leadership. So I'd like to end with just some thanks. First, a thanks to our board, our foundation board, our executive leadership team, our Racial Equity Action Committee for Health, our REACH committee, many of whom are on this call today, for not just speaking up, but for standing up for what is right, what is just, and what is equitable. Without everyone on this call's support, we would not be doing the right things, not just saying the right things as an organization. I especially want to thank Carolyn Link, who you'll hear from shortly, and Dr. Mark Steffen, because they have been amazing and instrumental and wonderful in working with Dr. Hardiman to bring this to fruition. I'd like to thank the U and especially President Gable for her tremendous leadership of the U, her involvement more broadly in the community, and we get to cross paths quite often, and it's always an honor, and for her partnership. And finally, and most importantly, a shout out and a heartfelt thanks to Dr. Hardiman for your vision and your diligence in bringing this center to life. For all that you've already done for our community and frankly for our nation, because I get to talk about Dr. Hardiman outside of Minnesota as much as I can, and for the work that I know you have yet to do through the center's research and work. So thank you again for having us today. Thank you for your partnership. We're looking forward to a bold and bright and equitable future going forward.
Thank you so much, Dr. Samet. Appreciate those comments, and it's obvious that we share so many values as well as we go forward with this initiative. This is just wonderful. Now I want to welcome Carolyn Link and Dr. Rachel Hardiman to the screen. and both of whom I am proud to say are alums of our School of Public Health. And in just a few minutes, they will engage in a discussion about the center. And I will introduce them right now, beginning with Carolyn. As president of the Blue Cross and Blue Shield of Minnesota Foundation, Carolyn Link oversees all operations and strategic direction for the foundation. Under her leadership, the foundation has increased its assets, its annual grant making, the percentage of grants has increased, that it makes to organizations. It's been led by people who would identify as Black, Indigenous, and people of color. In collaboration with the Foundation Board of Directors, Carolyn has also honed the Foundation's focus on the social drivers of health and has deepened its commitment to racial and health equity. In her role as Senior Director of Community Partnerships, Carolyn provides leadership direction for the Center for Prevention at Blue Cross and Blue Shield of Minnesota, with a focus on reducing commercial tobacco use, increasing healthy eating, and addressing upstream causes of health inequities. Previously, she worked on tobacco policy at the Minnesota Department of Health, and she also began her career as a registered nurse caring for children with complex health needs. Now, before I turn the program over to you, Carolyn, I do want to tell you how grateful we are at the School of Public Health for your efforts in making this center a reality. We know that it took hard work, it took determination, and a real belief in what's possible on your part. So as I have told many people, you are an alumna of this school that we get to brag on a regular basis, and what you are doing to improve the lives of people all over the state is so important. So Carolyn, thank you for being here, and I now turn the mic over to you.
Thank you, Dean Finnegan. Good morning. I am deeply honored to be part of today's celebration. As both a graduate of the School of Public Health and a part of Blue Cross and Blue Shield of Minnesota, I can think of no better way to honor our commitment to serve the people of Minnesota than the launch and support of this center. I'm pleased and honored to introduce Dr. Rachel Hardiman. Dr. Hardiman is a tenured associate professor in the School of Public Health in the Division of Health Policy and Management, and she is the inaugural Blue Cross Endowed Professor in Health and Racial Equity. Dr. Hardiman focuses her research on interpreting and explaining how racism in all its forms drives health inequities. Her overarching goal is to link racism to health effects in tangible, verifiable ways, identify opportunities for interventions, and dismantle the systems, structures, and institutions that allow inequities to persist. Dr. Hardiman has published widely in journals such as the New England Journal of Medicine and the American Journal of Public Health. Her pioneering work has initiated critical national dialogue on the devastating impacts of racism on health and on innovative approaches to eliminating racial inequities in health. Dr. Hardiman earned an undergraduate degree from Xavier University in Louisiana and MPH and PhD degrees from the University of Minnesota School of Public Health. Welcome, Dr. Hardiman.
Thank you so much for that introduction. I first and foremost must offer thanks to my ancestors, whose shoulders upon which I stand. My vision for this center and my drive to bring it to fruition would not exist without them. I particularly would like to call into the space today my late grandmothers, Ernestine Belton and Rhoda Hardiman. I must also offer a deep thanks to my family, my husband, Dr. Eduardo Medina, and our daughter, Layla, who is the reason I continue to believe we can and we must achieve racial justice and health equity. I'm also grateful for the foundation created by my parents, who have modeled for me the notion that to whom much is given, much is required. I must also thank my amazing colleagues here at the university who have supported my research and this vision along the way, particularly Dr. Jamie Slaughter-Acey, Dr. Brooke Cunningham, Dr. Rhonda Jones-Webb, Dr. Katie Casamano, and Dr. Tim Beebe, and community partnerships with trailblazers like Rebecca Polston, founder and owner of Roots Community Birth Center. Finally, I want to express my deep gratitude to Blue Cross and Blue Shield Foundation of Minnesota. It's your commitment to racial justice in Minnesota and beyond that has made this possible. Your gift to establish the center is remarkable. And as we were discussing the possibility of the center several months ago and sharing our ideas, it was clear to me then how invested Blue Cross was in making the kind of impact that could change the destinies and the realities of Black and Indigenous people across our state and across the country and give them hope for better, healthier lives. I'm grateful that our visions have come together at this critical time for our state and nation, and that this new center is the result. With this gift, the work of the center and the determination of colleagues and collaborators, both here at the University of Minnesota and beyond, I believe Minnesota can show the country how to overcome entrenched racism and forge a future where racism no longer has an impact on health. It will be a challenge for all of us, but no more challenging than spending a lifetime struggling against overt oppression and racism's subtle undermining effects on people's opportunity to thrive. I was grateful and proud to be named the first Blue Cross endowed professor in health and racial inequity last year. And now to see my dream manifested through the center and to serve as its founding director allows me to really truly devote my passion and expertise to cultivating health equity for all people. So from the bottom of my heart, thank you.
Thank you, Dr. Hardiman. Next, I have a series of questions for Dr. Hardiman so she can help us to understand even better, expand on her opening comments so we can understand the vision for the center and the work ahead. So first, Dr. Hardiman, you spoke beautifully of the inspiration of your family and ancestors and colleagues. Could you share some more for us about your vision for the center?
I would be happy to. So I grew up right here in the Twin Cities in Minneapolis, and from a young age, it was very clear to me that certain people, certain communities weren't as healthy as others. One example is I watched my maternal grandmother die from end-stage kidney disease at far too young of an age for reasons that I understood later as that were certainly related to the healthcare delivery system that didn't seem to value her needs and her lived experience. And I think we're a country we're a country that's built on 400 years of inequality and inequity, and for far too long, Black and Brown people within our communities have been existing within and navigating systems and structures that have created barriers to optimal health and well-being and to liberation, frankly. And so my vision for this center is based on the notion of liberation and the fact that we know it's possible and we can create it. We have to figure out the right tools, the right resources, and the right people to do the work. So my overarching goal as we embark on this relationship together is to radically change what it means to achieve health equity and to do the work every single day and to center anti-racism in the work every single day within every single decision and every process along the way.
Thank you. Next, could you explain how it is that racism affects health? And we know it to be a fundamental cause of health inequities. Can you take us upstream and help us understand that?
Yeah, that's such an important question, and one I think as the field of public health has grown and shifted over the years in our thinking and our understanding about the intersections of race and health, we are now finally at a point where we understand that racism is a fundamental cause of health inequities. And what that means is that health is based very much on our social context, where we live, our access to education, our ability to get good jobs, our ability to access healthy foods, and to access a healthcare system that feels trustworthy and offers high quality, equitable care. And so many of these factors I refer to as the social determinants of health. And what we have to understand is that at the root of why that social context matters for health is because of systemic and structural racism. And one of the sort of examples that I often offer when I have this discussion, whether it's with my students or during speaking engagements, that I think does a nice job of sort of making that the connection for folks actually happens right here in Minneapolis. So in the 1930s, Minneapolis and other cities began to shade in red on maps of parts of the city that were deemed sort of hazardous or unworthy of living in for investment by banks and other businesses. And that process eventually became known as redlining. And policies were put into place that dictated where the hazardous parts of a city were, and people of color were then the ones that were forced to live in those areas, or they weren't able to get home loans to be able to, or mortgages to be able to buy homes in other parts of our city. And we know that where people live impacts their exposure to environmental toxins, which cause asthma. A recent study actually mapped red line neighborhoods onto COVID data and determined that people living in historically red line neighborhoods are contracting COVID or at the very least are exposed to COVID at disproportionate rates. And even my research analyzing racially segregated neighborhoods right here in Minneapolis has determined that first and foremost, our neighborhoods are deeply segregated here in the Twin Cities by race. But furthermore, that the majority Black neighborhoods in Minneapolis have a greater police presence. So what we've seen is that these neighborhoods that have been segregated due to this historical decision around redlining, as a result, currently experience more police surveillance. And what we looked at is, does police surveillance matter for health? Particularly birth outcomes, preterm birth. And what we found is that people living, regardless of their race, actually, people living in a neighborhood with disproportionate police surveillance was associated with greater preterm birth rates. So a birth of a baby before 37 weeks gestation. And redlining is just one of the many forms, I think, of structural racism that are impacting the health and well-being and the opportunities to access high quality healthcare right here in Minnesota as well as beyond.
Thank you. The new center aims to be a leader in anti-racism research. Can you explain what anti-racism research is and how it differs from how research is typically conducted?
Sure, I think that's such an important question. And traditionally, health research has been built on, frankly, a white supremacist notion that race is biological. Rather than a social construct. And you can still actually find in medical textbooks and nursing textbooks statements such as Black people have higher pain thresholds than white people, or that Black people are genetically inferior. And as a reproductive health equity researcher, my research has highlighted some of the false and racist narratives such as these that are playing out in the way that maternity care is delivered across our country. Additionally, researchers have looked at the ill health of people of color and blamed those poor outcomes on the individual. For example, over the past few years, our country has grappled with the rising maternal mortality rate. So we see that as a country, we are the only industrialized nation that actually has a rising maternal mortality rate. And what's driving the rise in maternal mortality in the United States is the fact that Black women are 4 times more likely to experience maternal death, meaning a death during pregnancy, childbirth, or the year following childbirth. And early on, and I think this is slowly changing over the past few years, but early on, certainly, the reasoning behind this discovery and this disparity had been explained as Black moms are unhealthy, they're engaging in risky behavior, or tobacco use, for instance. They're obese, they're not seeing a doctor and getting all of their prenatal care. But when in reality, when we take an anti-racist research lens to that work and ask the questions in a different way, and also do our analyses in a different way, controlling for all of those elements in our models, what we see is that a Black woman with a PhD like me, or an MD, or high socioeconomic status is still more likely to experience maternal death than a white woman who has not completed high school. So my work from an anti-racist lens really digs into sort of the insidiousness of this reality to dismantle the victim blaming narrative that has certainly sort of created or elucidated how systems and structures of racism have contributed to frankly appalling outcomes such as maternal death. I think part of what's important with anti-racist research is to be able to see the water in which we're swimming. so much of, you know, the reasons behind health inequities are baked into the system and are embedded into just the way that we've always do things. And so anti-racist research calls for doing that differently and to really think very critically both about the historical context and understanding how that 400 plus years of inequality in our country has contributed to contemporary health disparities, while also thinking about the systems and structures at play. And most importantly, you know, anti-racist research calls for us to center at the margins, meaning that we shift our viewpoint away from that of the majority group and to really center those who are closest to the pain and the work that we're doing.
Thank you. Dr. Hardiman, are there ways in which you see the center as a model in the nation?
I think we have the potential to be the model in the nation, really. And I think that's for a couple of reasons. First, we have incredible, you know, the incredible colleagues I named in my remarks and many others that are doing this work and are building, you know, building anti-racist research into their areas of scholarship across the university, across the School of Public Health. I also think, you know, Minnesota is unique in that we consistently rank as one of the healthiest states in the nation. But that reality is only true if you're white. So for people of color here, what we know is that it's actually one of the worst places to live when it comes to health. We see that we fall way down to the bottom of the list on all of the indicators that we use to determine health and well-being when we start to look at what's happening by race. You know, the premature death rate for Minnesota's Indigenous people is just one example. It's more than 3 times higher than the rate for white people. Another example is that Black and Indigenous babies die in the first year of life at twice the rate of white babies. And, you know, that statistic has actually been a reality for as long as we've been able to collect those data. And also, you know, one of the other contexts that, I mean, and I offer all of this, which sounds sort of negative, right? To say that we have the potential to do better and to change. And I think that certainly the events of May 2020 and George Floyd's killing at the hands of a Minneapolis police officer have opened the eyes of Minnesotans who have had the privilege to not be aware and not had the experience of walking in the day-to-day of what it means to be a person of color in our state. And so my hope is that now that eyes are open, right, they can't be closed again. So I think we are uniquely positioned to do some really amazing things and to be a leader in this space. You know, we have an opportunity with the center and as a state to commit ourselves to closing these health inequities and creating health and well-being for our communities here. And you know, I can't think of any better place to do that than right here.
That is a perfect segue to our final question, to have you look out into the future. And when we gather together in 2031 to celebrate the first decade of the center's work, what will success look like?
Oh, wow. I love that question. I think there's a lot of things we will be able to celebrate in 2031, starting with we will all be together, right? in person, face to face. I dream of that day. I think I would love to be able to say that we've created opportunities for critical and probably some really hard discussions that were just beginning when the center was established. You know, so conversations about racism and its impact on health, but also looking within at our own institutions, right? And understanding what role we've played as a land grant institution, as an institution that has an important job to educate people in our communities. I see stronger relationships with community partners in that future. I see a center that feels like a safe space for and feels right and feels good for all folks who are engaged in this work. whether they are from inside of academia or working in the community. I see a place where lived experiences are valued, are heard, are lifted up, are at the forefront of the decision-making process of the work that's being done, and that those voices are being valued as evidence, and that we've shifted as a field in the way that we create evidence as researchers. So it's not just that we have published, in peer-reviewed manuscripts, findings from this work, but that we have contributed to policy change both here and across the country, and that we have made sure that the voices that need to be heard have been lifted up. And I would also say, one of my research goals over the years has been to really think about how can we and how should we be measuring and operationalizing structural racism in our research. And in 10 years, I think we'll be able to say we've done that and we do it well, and that we are a model for how to do that across the country. And we have created a way that we can contribute to national policy conversations that helps others to dig into this work. I think, I guess I have a lot of a lot of ideas about we have a lot of work to do. I mean, I think this speaks to the fact that we have a lot of work to do, because I also in 10 years would like to say that we have recruited a incredibly bright and diverse student body and faculty. I'm just the second Black faculty member in the School of Public Health, and while several more have come after me in recent years, we still have a lot of important work to do to build that legacy and to really think about how do we support and engage people across across the spectrum in the work that the center is doing. And I think I would say that, finally, my hope in 10 years is that we will have made significant progress in dismantling structural racism and shifting the dominant narrative that holds up whiteness as the ultimate standard, both in research, but also in the way that we sort of exist in our society. And I look forward to doing the work with all of you and whoever else wants to jump in and roll up their sleeves.
That's fantastic. Thank you, Dr. Hardiman. I look forward to that celebration in 2031 and the many milestones that we're going to celebrate together in the next decade. Thank you so much. Congratulations. This is truly an exciting vision for the work ahead. I'm going to turn it back to Dean Finnegan.
And thank you so much, Carolyn and Rachel, for that conversation. I think this also underscores why the School of Public Health is making the changes that it needs to make. It's one thing to do this work, but the institution itself has to be anti-racist. And so all the things that we're doing to increase our diversity, to deal with the structural issues, and not only in School of Public Health, but in higher education and generally, all of these things become so important. I think the thing that most fascinates me about your conversation is that some of what's embedded in it is the idea of moving away from scarcity approaches to the world to abundance approaches. And what abundance is all about is building the partnerships and the relationships. And you can't have the kind of human thriving that Rachel envisions without that kind of a change. And it has to be nationwide, it has to be in each individual, it has to be in all of culture. And I think the structural racism issues that have blocked people of color, Black, brown, and indigenous people from a life of health and well-being, those are the real issues. And none of us, white or any color, can fully experience health and well-being unless everyone is able to experience that. So I really do appreciate your conversation here, because I think you've really helped to zero in on the future role of public health in a post-COVID world. I too hope that in 10 years, I'll only be 81. So in 10 years that I'll be able to be there at that celebration. This is great. Just thank you so much for this conversation. Thanks to Blue Cross and Blue Shield for taking a risk with us, although I think it's going to be a risk that is well worth it for the health of everyone in Minnesota. So I do want to thank Carolyn and Dr. Hardiman for being with us today on this. Personally, I'm also filled with gratitude and hope that the impact that this center is going to have in our community is going to be a great one. And not only here in Minnesota, but also beyond as well. And now, to close our program, I get to welcome back our Gopher mascot, Goldie. Go for it.